Yes, hi. Hello, everyone. This is Dr. Khan. I have a nice, pleasant lady who comes to me who's post-op day number 4 now from her surgery. And if you could just share with us what your post-operative course, how have you improved with your BII symptoms?
Well, since I woke up from surgery, I have not had any pain in my feet or my elbow, which were my two huge symptoms that I had. I could not stand on my feet without wearing orthopedic shoes. I'm 40, so I didn't think that would be happening at 40 years old, but I think that my symptoms were brought on by pregnancy. I had twins. They're not even 2 years old yet, so about over a year and a half, I had since the pregnancy, really bad pain in my feet. I could not stand on the arches of my feet. My elbow was swollen, and everyone had told me I had tendonitis from holding the twins and going back to work and typing. And I tried literally everything on my elbow. I did acupuncture, essential oils. I went to the chiropractor for 2 months because they thought it was going to be stemming from my neck down to my elbow. What?
Physical therapy.
Yeah, I did physical therapy twice. I did a full session physical therapy. I got a shot in my elbow. It gave in because I like all natural things, but I got a shot in my elbow for the cortisone shot, which wore off after like 3 months, I want to say, of work. It worked for a minute, and then it wore off. And as soon as it wore off, I went back to physical therapy. Nothing worked. I literally tried everything. The second I woke up from surgery, I have not had pain in here since. It's been 3 days, and I used to not be able to straighten my arm past here, probably. I would literally hold my arms like this and look.
How long was that going on for? How long was that going on for?
A year and a half since
Wow.
I had my babies.
Now, let me ask you, we'll ask you on the next visit when you come see me, do you think this is a placebo effect?
There's literally no way this could be a placebo effect. There's not a chance. I tried everything. If it was a placebo effect, one of those other things would have worked for me.
Okay.
So, for sure.
All right. How was your anesthesia experience?
Good. I remember walking into a nice room and I was like, oh, it's really bright in here. I like it. And said a few things. I have a tattoo one of them asked about. They're like, is that a tattoo? And then I said a few things. They put a cool pack on my leg, and that's all I remember. I was out.
Right.
I was probably out within like 2 minutes of walking into the room.
Sure. Next question. You said also your skin.
Yes. I had super rosacea, I guess, like all over my skin. Really red skin. When I would get out of the shower, it would take a while to take down, and I'd put not concealer, but like a clear tinted lotion over it just to try to smooth out my skin, even out my skin tone. And it's gone. Like, I took photos the morning before I came in, and that night after I went home, and my skin was completely different.
Sure. Now, the next question, did you think you need a lift from where you are today?
I don't think so. From the results I see so far, I don't think so, and I think it's only going to get better, and they look pretty decent for what for what I thought it was going to be. I didn't really think I had that much breast tissue left, or I didn't know what it would be after 16 and a half years. Also, they were saline implants. A lot of people think that saline won't do this to you, but clearly the pain in my feet and the pain in my arms and a whole slew of other things, I'm sure I've got to see change. So.
No, absolutely. Saline implants are as bad as silicone in a sense that the symptoms, the causes, the BII symptoms, so very much the culprit. Now, thank you very much for sharing your information and your journey, and we'll continue to follow you and see how you do. Thank you so much.
Thanks.